So one of the first things we're going to talk about is why has nursing education changed? And there are a lot of things that have influenced the way nursing education has been conducted and how people have entered the field into education. And as students that are starting to prepare to become nurse educators, you just have to be aware of what the history is. So the nursing faculty shortage has gone hand in hand with the nursing shortage. The more shortage there has been in clinical settings, the more shortage there has been in faculty roles. Part of the reason for that, a lot of things, they're listed here, but healthcare reform, as changes have been made to how healthcare is delivered and how healthcare is being paid for, obviously the way we educate people and the reimbursement for education has changed as well. There are changes in the delivery of healthcare and how we do it. We're moving more things to an outpatient setting. There are more types of care being given by differing levels of staff than there ever used to be. And I think you've experienced that in the healthcare setting yourselves, but that also influences what we have to do and how we have to change nursing education. Evidence-based practice, technology, and outcomes of secondary education are all factors. And then clinical competency and educator competency are things that you always are going to be talking about and looking at. Does clinical competency equal educator competency? And the answer to that is really no. And you'll find people, I think not so much now, but you may run into people that are a little bit older in their practice that they really never went and got a master's degree specifically as a nurse educator. Most of them have a degree, an advanced degree in some specialty field, or they may be a nurse practitioner, but they didn't really focus on education. So clinical competency does not always equate to educator competency. Okay. Challenges for nurse educators. One of the big discussion topics that happens all the time is how do I maintain or remain clinically skilled and still teach? And as you know, if you're teaching full-time, you're not in a clinical setting most of the time. And so it's a real concern for folks. And as new educators entering this field, you're probably thinking that. Right now you feel highly clinically competent. You've been working in your field for a little while. How do I know that I'm going to be able to maintain that level of competency if I'm teaching? So as you may find out, and if you don't know, you may want to ask a few of the educators that you have a relationship with. Most people do something to maintain a clinical competency. So either they'll do a per diem shift now and then in a hospital setting, they may work in a clinic, they may offer volunteer services in clinics, but it is important to maintain some level of clinical competency to be a valid teacher. It's really hard to talk about changes in healthcare if you aren't a part of them and you haven't experienced them. Also, how do I maintain a specialty certification? Most of the time, that's a little bit more challenging. Specialty certifications usually are based on a full-time year of giving care to somebody directly in that specialty. Most of the time, your specialty certification will now be replaced by an educator certification. You'll still have to do as many continuing education units, but the specialty now will be education. There is also a thing called the practice education gap, and how do I work with that is a question that's commonly asked, and that is the idea between how do I bridge the gap between being competent and being skilled in my practice and being skilled and competent as an educator, and where do those two things kind of intertwine? It's a common concern for most of us in education, and you have to always be trying to bridge that gap, but being aware of it is the first step. The shortage for nursing faculty has been looked at by a lot of people, but one of the areas that focused on it the most was the Tri-Council. That's the group of the American Nurses Association, the American Organization of Nurse Executives, and the National League of Nursing. They're called the Tri-Council, and their findings were that there's a serious shortage of nurses prepared to be faculty. The problem is that we have a serious shortage of nurses, and there's fewer and fewer people wanting to go on beyond their bachelor's degree anymore and maintain and get a nursing master's degree in nursing, specifically in education. Part of that has to do with salary. Part of it has to do with the two components we just discussed about being clinically competent and certified. The last thing that's one of the challenges for nurse educators is aging and retirement. And unfortunately, most of the faculty that you will come across usually are either a little bit older or they're doing this as a post-retirement job for them. And the reason for that is really because salaries for nurse educators are not where they should be. So there's high demand for tenure track. For most of you, if you don't work in a college setting, you wouldn't worry about that. But if you're looking at college or university setting to work as an educator, the tenure track is what is most desired. Unfortunately, most universities and colleges are limiting the number of tenure tracks that they're offering anymore. So a lot of times educators only want to work if they're going to be hired in a tenured track. So it makes the field for trying to find competent faculty more difficult. There's an overwhelming workload and salary limitation, and those two things don't go well together, but there is a lot of work. The hours are sporadic, and the hours can be long at times and then more relaxed at other times. Salary limitations, a lot of times when people are especially in nursing or getting their master's degree in nursing, they're expecting if a nurse practitioner makes $100,000 a year, so would I as an educator because I have the same level of education. And the answer to that is that it's not true, and you won't make $100,000 most of the time as a starting salary for an educator. So that creates some shortage because people say, well, then I'll just get my degree and work as a nurse practitioner. But the difference is in what your desire to do with your degree. And there's also a perceived lack of collegial relationships when you're working as an educator, that you won't have anything in common or you won't maintain your relationships with people in the clinical setting. And I think that that's and it's really kind of a myth, in that collegial relationships are really based on what you do and how you maintain relationships in general, and they aren't influenced really by whether you're working in education or not. Okay, so the role of the future, there's going to be a refocus from teaching to learning. Oftentimes in an educator role, people feel like their job is to educate and to teach. And unfortunately, sometimes what gets lost in the shuffle there is the fact that your role is really to help people learn, not just to teach. So there's a change from community-based to consumer-driven learning. And that's really going to be a challenge for us as educators. So instead of us looking at, here's a group of people that we're going to educate on a certain topic, we're going to be looking at it as consumer-driven learning, that there are certain things that people want to know about, and how they want to obtain that information is going to be a constantly moving target for us. There's going to also be a move from acute care to primary-based care, which forces a change in nursing curriculum. Right now, the curriculum probably has changed minutely in most undergraduate nursing programs of study in the past 15 years. And unfortunately, healthcare has changed much quicker than that. So there's a huge need to drive curriculum change to meet the needs of nurses being graduated out of programs. And there's also going to be a shift to cultural competency. And we talk about that, but we don't really practice it in the degree that we're going to need to in the future. So those are all things that we're going to look at as the role of the educator going forward. All right, now I would be remiss if I did not talk about curriculum, since this is a curriculum course. This isn't information that you're going to need to know for any of your projects, but I don't want you to complete a curriculum course and not know some of this. So curriculum, the definition of curriculum is literally in Latin is to run. And what we've expanded that really to is it's a course of study, or three major criteria for a curriculum are continuity, sequence, and integration. So those are the things that we're looking at that develop a curriculum. Continuity are the key concepts or skills that are incorporated in the curriculum to support skill acquisition. That's very pertinent in nursing, and I think you've all seen it and practiced it. Sequence is attention to new learning experiences building upon prior ones. That we don't do as well at. It's sort of like saying we want to have things that we teach you early on be things that you build on. In this program of study that you're in, you'll see throughout this course that I continue to build on the other courses that you've already taken. You'll see references to Nursing 561. You'll see references to other courses that you've taken in ethics. And the idea is that we need to always be looking at the sequence and add things so that we're building on previous acquisition of knowledge. And last is integration, how learners develop an ability to apply skills learned across variety of subjects and situations. And if you look at those three concepts, they are what we are talking about when we say curriculum. So I think we refer to curriculum a lot, and people think that just has to do with like program of study. And that's true, but I think there's specific concepts that you need to be aware of. So types of curricula, there's operational, and there's really four different kinds. There's operational, illegitimate, hidden, and null. And some of those titles sound negative, so I don't want you to feel like that's what I'm inferring. But operational is what's taught by the teacher and how its importance is conveyed to the student. How its importance is conveyed to the student. So most of the time, that's traditional. That's what we see. It's what the teacher is talking about. But sometimes we see people lecture, and the importance of what they're talking about sort of gets lost in the lecture. So operational is one type of curricula. Illegitimate is taught by faculty and faculty yet not able to be evaluated. Those are things like caring, compassion, power, and unfortunately we use a lot of that in nursing. There's no way for us to measure how much a student cares about the patients that they care for. Hidden curricula, values and beliefs that are taught through verbal and nonverbal communication by faculty. Sometimes we can have a hidden agenda. And unfortunately, hidden curricula is usually very, very influential to students. So you have to be aware of it, and you have to be very much in control of anything that you're doing that has a hidden value to students. And lastly is null curricula, the content and behaviors that are not taught. So in nursing, often, we don't really know how to teach somebody critical thinking. We don't know how to teach clinical reasoning, how to make good judgments, how to make assessment by using your gut instincts. Those are things that we really can't teach. However, we do expect students to develop those skills. So it's those are just things I want you to be aware of, that curriculum is a complicated topic, and we aren't going to cover all of it in this 6-week course. All right, and then nursing curriculum transformation. Obviously, we have to keep looking at the curriculum and moving forward with what the needs of nurses in general are, and how is nursing education supporting them or not supporting them. So nursing curriculum was traditionally based on practice, accreditation standards, regulatory requirements, and faculty interest. It had very little to do with some of the things that drive healthcare today. New curriculum needs to include some of the following: focus on delegation, prioritization, supervision, clinical reasoning, and decision making. I think any of you as a new nurse, you've seen that you leave nursing school and you're immediately put in a position to delegate, supervise, and prioritize. And those aren't things that we're strong at teaching. There needs to be a focus on health promotion, disease prevention, and care transition. We're moving patients out of the inpatient settings into ambulatory care settings much quicker, and the idea of health promotion is what insurance companies are driving in the healthcare field. Another thing is enhanced student-faculty preceptor interactions. So no longer can we just pawn students off and say, you're going to go with a preceptor and we hope you get what you need. Teachers need to really be a part of the preceptor-student relationship. Immersion of the student into practice settings. I think you're seeing more and more of that. Hopefully in your undergraduate education, you saw that no longer do we talk about a practice in a field, but we send you into the field to do it. Evidence-based research and practice and integrating patient-centered care, culture of safety, and quality outcomes are all things that are being driven in healthcare right now, and curriculum does not support them currently. So we really have to start looking at how we, you and I, as nurse educators of the future, are going to transform the nursing curriculum to support practice in today's society. Lastly, we have a social context. We are looking at global disease, global violence, natural disasters, and aging population and technology changes that really are influencing everything that nurses have to do and understand. And yet our curriculum doesn't support much education in any of those fields. All right, so that's the end of that PowerPoint presentation, and I just wanted you to have that as some background, that the book doesn't really go into that level of detail, but I think you're not going to find that in any other course at this point, so I wanted you to have some of that background as you start in this course.